All right, here we go. We're going to start talking about the different types of shock and what they are and how they all work. So the first one we're going to talk about is cardiogenic shock. Cardiogenic shock is obviously about the heart, right? The heart's there, hey, I need some help. The heart itself is actually having trouble pumping blood. And there's a few reasons for that, and we're going to talk about them right now. So one of them is arrhythmia. So whether you have a heart block, or maybe that heart block is causing your heart to beat too slow, so it can't pump the blood. Maybe it's having trouble contracting tight enough. The contractility isn't strong enough to push the blood out. If you have an SVT, which is very fast heart rate, so now the blood can't get into the heart, so the heart can't fill up enough blood in it because it's got to beat so fast it can't fill up properly to get the blood out. Myocardial infarction, the actual myo, which we talk about, which is the muscle in the heart. So we're talking about the heart muscle, is not getting any oxygen or glucose. And usually it's oxygen because there is a blockage of one of the main arteries or main arteries in the heart. So that way that area of the heart is not getting the oxygen or nutrition it needs. And then if you have any type of physical damage to the heart itself, so like if you've had a knife wound that's deep enough, it's actually damaging the heart itself and it isn't able to function. So some of the stuff we look at, basically we talked earlier, we're talking about like supportive care. It's just basically make sure your oxygen, give your fluids if needed. You might give nitro, but make sure if you're looking at an MI, if it's a right side MI, double check you make sure you're safe to give the nitro because right side right side ventricular involvement can lead to a badness when you give nitro. It drops their pressure really bad. But for mostly if you're an EMR, you need to give this patient some oxygen, and the biggest thing we don't want to do is exert this patient, this minimum patient exertion. We do not want to put any more taxing on this heart to make it any harder for them already. So that heart is working and it's not working well. And if we make this person get up and walk to our stretcher like 5 feet, we make them walk to the ambulance, could be even over 100 feet. This is going to make it harder for them and it's going to cause more damage to their heart. So we got to make sure we do that. Next, let's take a look at how shock blocks goes. So when we're looking at shock blocks, right? This is the one that's not doing well. The heart isn't functioning very well. So what's going to happen is, because it can't move as much blood, right? There's decreased output sometimes, and that's usually what it is. It's decreased output of blood. So we're going to have a decrease in oxygen. We're going to have an increase of CO2. We're going to have decrease of glucose being distributed. So in turn, it's going to affect these other blocks, right? The brain does not have a whole bunch of reserves for oxygen, so you're going to see sometimes, depending on the severity and how bad the heart is not functioning, how much you're going to see affecting the brain. Again, with the increase of CO2 is a big vasodilator, so now the brain's going to tell the body that it needs to constrict to try to push more pressure to maintain that blood pressure. So as you can see, that as the heart gets worse, as we're talking about compensation, so the compensated shock is all these things going on to help out that block to maintain perfusion. But what happens is after a while, they cannot maintain perfusion. We end up in decompensated shock. And what happens there is that now this block that becomes out of place, this block comes out of place, and this one as well as container. So now at this point, we're looking at basically decompensated shock. So all the systems aren't working together, and the next step that we're looking at is irreversible shock. So anyways, that's cardiogenic shock. Just remember, cardiogenic shock refers to the actual heart. There's something wrong with the heart. And we'll see you in the next one.